Roland was a warrior from the land of the midnight sun, with a Thompson gun for hire, fighting to be done. The deal was made in Denmark on a dark and stormy day, so he set out for Biafra to join the bloody fray. Through 66 and 7 they fought the Congo War, with their fingers on their triggers, knee deep in gore. For days and nights they battled the Bantu to their knees. They killed to earn their living and to help out the Congolese. Roland the Thompson gunner, Roland the Thompson gunner.
All right. Well, hey, everyone. Thanks for joining us again. This is our fourth Healthcare in the Heartland series of webinars. We kicked off our Dakotans for Health campaign to expand Medicaid with Senator Daschle back in November. And since then, we've had former Congressman Earl-Pomeroy and Mary-Wakefield, Earls from North Dakota, actually voted to pass the Affordable Care Act. And like a lot of courageous members of Congress that did that, lost his reelect, and unfortunately in 2012. And we had Mary Wakefield, who is well known to people in the healthcare space. Mary was the number 2 at HHS during the Obama administration, and understands healthcare inside and out, and really added a lot to our evening discussion. We also had some local South Dakota folks who have been helpful in moving public policy. Steve-Hildebrand, who I bet a lot of you know or know of. Steve almost single-handedly chased the payday lenders out of South Dakota in 2016. And then actually my brother, Dr. Weiland, led an effort along with a number of other organizations to chase secondhand smoke out of our restaurants and public spaces. And then, just recently, we've had minimum wage passed in 2014. That was led by the South Dakota Democratic Party and organized labor. And we also were able to pass an anti-corruption campaign finance reform bill in 2016, which unfortunately was repealed by our legislature. But it was a very expansive effort for transparency and public financing. And just recently, as you all know, we were able to pass some medical and recreational marijuana reforms. Unfortunately, we had some bad news yesterday. One of the lower courts has ruled them unconstitutional. So I imagine that'll end up in the Supreme Court at some point. But we are poised to get Medicaid expansion on the ballot. And these, I think, very substantive and call to arms, call to action efforts to fire up the base, fire up the donors, to collect signatures, are just absolutely critical to making this thing work. We have over 150 people right now who have downloaded our petitions, that are talking to their family members, their friends, their neighbors. We've told them to wear masks and wash their hands, and not necessarily stand on the street corners right now because it's a little bit too cool to begin with, but we are dealing with a pandemic. But those signatures are starting to flood in, which is really an encouraging sign. I've been so impressed with the grassroots organic support for expanding Medicaid. And it's really a no-brainer. We got our fiscal note back from the Legislative Research Council. We're talking about providing health insurance to about 42,000 of our fellow South Dakotans. That are many who are working full-time jobs, but simply cannot afford to buy private health insurance For them, it's the difference between probably paying their rent and putting food on the table. So they're going to get some coverage, some good coverage. And, the state's going to get $308 million a year in federal dollars. And if you think about that, for what the state has to spend, and I know our guest speaker tonight's going to talk about what he was able to accomplish in Montana. But for what our state has to spend at 10% of the total cost is a 15-to-1 return on investment. I mean, it makes no sense that this hasn't been done. We could have expanded Medicaid back in 2010 when the ACA passed, but there's been a complete lack of leadership. And it's just time to get it done. And some good news today that came out of Washington with President Biden's COVID package. There is going to be a further incentive for states that haven't expanded and states that have, but the feds are going to kick up the cost share from 90% now to 95%. So South Dakota, we did a press release today. We said there's another 180 million reasons more to pass Medicaid expansion in South Dakota. So South Dakota would get about $90 million more each year for the next 2 years if we can pass expansion here in 2022. So it's a very exciting time, and I see a lot of familiar faces, and it's always so good to see so many people I know, but it's almost even better to see people I do not know, because this is what has been really exciting about this campaign is it's so organic and everybody really seems to get it and know how important it is. So that being said, I do want to introduce our guest speaker tonight. He and I share a passion, I'll admit, not only a passion for politics and public policy, but also a passion for getting big money out of our politics, driving our public policy. As many of you know, I ran for the Senate, and that was the cornerstone of my whole campaign, was overturning Citizens United. Well, that's been Steve Bullock's passion as well. And, he not only has served as the Attorney General of Montana, but a two-term governor, a candidate for president, and a U.S. Senate candidate. And we've gotten to know him the last couple years. Adam and I told him the other day that we would move to Montana if he decides to run again, because he's the kind of people we need in office. And I know his future's bright no matter what he decides to do. But he's going to tell you about how he built back better in Montana many years ago, before our president even gathered that slogan. And as we're proposing to build back better here in South Dakota, you're going to hear a case study from the horse's mouth. And I'm going to introduce our good friend, Steve Bullock. Steve?
Great. Thanks so much, Rick. And look, it's great to be with my neighbors to the east. What I'll say is the unfortunate dozen. You're one of 12 states, about 12 states now. It's leaving money on the table that's not taking the steps to pass Medicaid expansion. And as Rick noted, this, the politics around this in some respects still sort of confound me. Because when you can do something that is good for your economy, good for your citizens, good for your tax revenues, good for your businesses, why we wouldn't take those steps in some respects it really is confounding. When we first got Medicaid expansion through, it was in 2015. And at that time, the word Obamacare was about as popular as athlete's foot. But somehow along the way, I'll never forget, we got it through legislatively, and Democratic governor throughout my time as governor, my legislature was somewhere between right about two-thirds Republican. I'll never forget going to a town called Choteau, Montana. And because I made it in 2015, went to all of our rural hospitals. And Choteau's a town about 1,700 people. It's along the Rocky Mountain front. And I show up at this community meeting, and, it was pretty darn clear that there weren't a lot of Bullock supporters in that room. And people that were, on the one hand, pretty skeptical about this thing called Obamacare. But instead of telling them what they needed, I listened. And when the hospital administrator said, 40% of the people that walk through these hospital doors don't have health insurance. And then the chair of the county commission, he wasn't even from Choteau. He was a crusty old rancher. He's from a town called Bynum, population 50. We'd call that a suburb of Choteau, like you have many suburbs there in South Dakota. And he goes, folks, this hospital has saved my life 3 times. I was born here. I had a heart attack. And I can't remember what his third was, but he said, and if we lose this hospital, this town's gone. So it was them actually not saying there's something bigger than politics here. There's something bigger than partisanship. There's about maintaining our way of life and the recognition that here is a way that we can really advance that. And what we've learned over the past 6 years is the value of Medicaid expansion, the value of preserving access to physical and mental health care for almost 10% of our population, sustaining thousands, literally thousands of jobs, hundreds of millions of dollars in our state's economy, and serving as a lifeline to those very rural hospitals. Coverage for, when I say right now, I think it's in the 90,000 Montanans that have coverage, but that includes 10,000 veterans and their families. It includes 15,000 Native Americans. And we went from an uninsured rate from about 20% to 7%. So in my general overview, I want to talk because it is good for our rural communities. It's good for our economy. It's good for Montanans or South Dakotans, and it's good for our businesses. 20% of rural hospitals are at risk of closing right now in this country. And that was even before COVID-19. In Montana, we haven't lost a one. And if you look even prior to COVID, that states that didn't expand Medicaid, 6 times more likely you're going to lose a rural hospital or rural hospitals. And that county commissioner knows what all of us know that come from rural areas. You lose one of those healthcare communities, and that hospital is dang near gone. And what we've seen is almost half, 48% of those Medicaid expansion enrollees in Montana actually live outside of our 7 largest urban areas. It's led to the decreasing, that when that healthcare administrator said 40% of the people that walked through those doors didn't have health insurance. Let's not kid ourselves. They were still getting coverage at the emergency room where it was most expensive. But all those costs were borne either by the hospital or those of us that had insurance. And what we found was decreasing uncompensated care costs over $100 million, 45% in the first year of expansion alone. It's good for our economy. Rick mentioned some of that. We have more than $47 million new tax revenue in our state. We now know 9,700 jobs were created since 2016. Almost 800 million in associated wages, adding 600 million in economic output to our state's economy each and every year. And through this, 6 to 9% more low-income adults actually joining the workforce and then becoming the taxpayers. It's good for the Montanans that you'll be fighting through the ballot initiative and coverage of South Dakotans, but folks in all corners of our state, we have to recognize who we're covering with Medicaid expansion. 9 in 10 of our enrollees in our state have an income below the federal poverty level, less than $12,140 for an individual, or $20,780 for a family of 3. And we learned that healthy Montanans work. Medicaid coverage actually makes it easier to work, to find a new job, to succeed in today's economy. We found that nearly half of our enrollees reported improved general health since becoming covered by the plan. 65,000 Montanans getting preventative care, 15,500 vaccines, 17,600 wellness visits, 41,000 dental exams, 195,000 screenings, catching harmful diseases early, 8,000 women receiving breast cancer screenings, resulting in more than 100 cases of cancer diagnosis and treatment, more than 30,000 people receiving mental health services. We doubled the number of substance use treatment providers in our state. And it's so easy to lose the fact that those are a bunch of statistics. But behind every single number is a potential success story. It's a success story of what healthcare has done for their life. And we've also learned that it's really good for businesses. I mean, I think often in states, including what it was in mine, where folks said, well, why would we do this? This is just providing free healthcare for a whole bunch of people that aren't willing to work hard enough to get it. We know that 7 out of 10 of those enrolled in Medicaid expansion are working Montanans. 8 out of 10, if you also include like caretaking for someone sick in their own family. And what we did is we finally really dug into the data after having it for a while. We realized this isn't a program to just take care of individual Montanans. This is a program to take care of businesses. Businesses that are unwilling or unable to provide health coverage for their workers. Almost 60%, 58%. 3 out of every 5 businesses in Montana have 1 or more employees that receive their health care through Medicaid expansion. In all 56 counties, in every industry, it's benefiting businesses. Of our 56 counties, 49 of them have over half of their businesses in that county that employ people on Medicaid. We're talking about over almost 25,000 businesses. And more than just that, what we found is if employers had privately insured all those workers enrolled in Medicaid, costs would have been somewhere between $430 million and $1.1 billion in 2019 alone. So employers benefit from Medicaid expansion, certainly through cost avoidance of not paying for private health insurance or avoiding tax penalties. They benefit by having healthier employees. They benefit by having a healthier workforce. So again, I applaud what you're undertaking here. It is confounding that any state, when you know that it's good for your businesses, it's good for your rural communities, it's good for us, South Dakota has, Montana has, Indian country. It made it so Indian health services, which was always just life and limb, even in our tribal nations then, actually preventative care was a possibility. It's good for our rural communities to keep those hospitals alive and thriving. So good work, and I look forward to having the conversation this evening.
Thanks, Steve. So, Steve, let me kick it off with a question. Who opposed it? Who opposed it with your legislative effort, and who opposed it when you had to go to a ballot measure? Where did the opposition come from? How much money and how well funded were they?
Yeah. And to give a little bit of background, so we passed this legislatively in 2015, yet it had a 4-year sunset on it. And as opposed to trying to get it through my legislature again, a number of entities and I supported, we decided to do a ballot initiative that ultimately didn't pass. In 2015, when we were first pushing it legislatively, as far as who would oppose it, certainly sort of the Americans for Prosperity and others, but not everybody was bought in, right? Because Obamacare really was a dirty word at that time. And the misperceptions more than the reality. I mean, the many Republicans who would just turn around and say, yeah, this is just a handout for a bunch of folks that are unwilling to work, or that it would bust our budget. So there weren't that many organized entities. Healthcare, because my first session was 2013, we were unsuccessful. Healthcare was not as helpful. Sort of the greater hospital, docs, everyone, community came on board. When we went to renew it by ballot initiative, though, one of the things that we did is proposed a $1.50 increase, $1.50 tobacco tax increase. So even though that we knew the benefits to our economy, even though we knew everything that this did, tobacco companies spent, I think it was north of $20 million killing this. So I walked into my last legislative session, it not getting renewed at the ballot box by initiative. And it really was because, I mean, there was no discussion about Medicaid expansion through this. It was the tobacco companies did a real good job of just so confounding people and saying it would hurt veterans, as an example. Notwithstanding the fact that we have over 10,000 veterans and their families that aren't VA eligible getting health care through this. But we had to walk in and at least had that base experience to know how important it was for our economy, for our overall healthcare. You have community health centers all across your state that allow and take anyone in on a sliding scale, no matter what they could pay. Look, the revenues for community health centers doubled as far as the amount of money they got to Medicaid once we did expansion. So we knew it was important enough, and it's one of those that, and you know, I feel sorry for you for the long fight that you've had, because once you have it, you recognize, and I think the state collectively recognizes, even though there's certainly will always be ideologues, how important it is for not just the health of individual South Dakotans, but the health of your economy.
Absolutely.
Add that. There's always a lot of talk here about the impact of Medicaid expansion to state budgets. And, you know, it can be really confusing to talk about these things, because you're talking about extra state revenues and all of these complicated things that you're an expert at doing. So what I would ask you is, if somebody says that, you know, this is going to have some sort of this is going to put us in the hole, and it doesn't pay for itself, and you know, it's just another example of a freeloading program that this state can't afford, and we're going to have to take that money from other sources. You know, how would you respond to a criticism like that?
No, a couple things. First of all, as a Montanan, I would thank you for sending your tax dollars to Montana so we can provide health coverage, right? You're paying the same taxes either way, the federal government, and the difference is whether you're going to get 90% of these costs reimbursed. And what we found when we passed expansion, too, that there were savings from other Medicaid populations that then we could shift into that 90% pool, more or less. And what we're seeing time and time again then is, like, when you talk about 9,000 some new jobs in this state, those are all folks paying taxes. They're all paying taxes. When you look at the overall economic impact of another 600 million in economic output each and every year, that's an investment that you almost can't afford not to make. And then you were noting about, you know, they always say, well, your enrollment may or may not be as high and things like that. Look, my goal is always to say, I'd love it if no one was on Medicaid expansion, because I know that 3/4 of the people receiving it are working. Ideally, right, the idea is that you get paid enough to actually be able to go on the exchange or get health care. But the unfortunate reality is that that isn't the case. So until then, it is providing health care, and not where it's most expensive. I mean, we always forget about the cost shifting that occurs by folks waiting until what could have been a preventative illness. But because they don't have health care, waiting to go to the emergency room where it is the most expensive care, and those costs are all shifted onto all of us that actually have health insurance. I think that almost every state that's faced that, Adam, when you actually look at the new tax revenues coming in, are there costs with it? Absolutely, when you expand a population. But the federal government's paying 90% of those costs. And I know that 60% of my businesses in this state are actually benefiting. I mean, sitting down with some, most all Republican legislators, like, oh yeah, now there's plenty of jobs in my county and jobs that have health care. And I did a county by county survey, and I said, well, let me tell you about Custer County. 62% of the businesses in your county, or whatever the number was, working people are getting their health care through this program. So we are helping your businesses as much as we're helping those individuals.
So that's great.
Adam, I think we should open it up to questions, and if people can use the raise the hand button, you can just call on them. Great opportunity. I was looking at some of the material in Montana, 19-to-1 return on investment in Montana. So for every dollar Montanans spent, they got 19 back. $2.65 billion in federal support. And then you've been talking about jobs, which I think is a really strong argument to make in South Dakota, because a lot of small businesses really can't afford to provide health insurance, and it's too damn expensive for their employees to buy it on the exchange. So they take the risk and go without, and then they get sick, and there's that cycle all over again. They're in the emergency room getting the most expensive care, and then the hospitals figure out how to pay for it, and they pass it along to people who do have insurance through copay increases and premiums and costs, overall costs. So it's a vicious cycle, and I'm increasingly confident that because the ACA has stood the test of time and has become, in some respects, almost another third rail in politics, like Social Security and Medicare. People are saying, don't touch my pre-existing condition coverage, and don't touch my lifetime cap, which was removed, or I want my kids to be on my policy until they're 26 years of age, so they have some kind of coverage. I think we're getting very close to the point where that ideological argument is not going to have the staying power it had when Steve was fighting with them back in 2015, 2016, or 2014. That's why I'm so optimistic about getting this done.
Okay, how about Councilman Richie Nordstrom's got his hand up here. Richie, let's get you teed up. There we go. You're on.
Primarily what I've got is about 3 different short comments, and maybe not so much a question when we get done. We'll see what happens. But essentially, one of the biggest things here in Rapid City is we get together with Monument Health about once a week to hear what is taking place, primarily during the pandemic. And one of the factors that has played a major role in especially shows up the weak points within a pandemic, is the ability to maintain and recruit employees, in this case, doctors and nurses. And Monument Health has told us that Medicaid expansion would be a good thing to help them out in that area. The other big thing is that Governor Bullock mentioned the point about rural hospitals closing up. Well, one of the things that I've been reading about in recent news articles is that there is a major shortage of doctors in the rural areas. What I've come to a conclusion is, and you can correct me if I'm wrong, is that if we don't have doctors, we don't have hospitals, and vice versa. So the big thing is that based on the information I've gotten from Monument Health, Medicaid expansion would help those rural hospitals in both regards, with recruiting and retaining doctors and nurses in rural hospitals. And my third and last point is that one of the other factors that we have here in Rapid City is a great demand for mental health. And that's one of the other factors that come to play in my mind with the issues of people don't pull their bootstraps up. And when they don't have bootstraps to begin with, they haven't got anything to pull up. So the biggest thing is that if we had some mental health assistance for them through Medicaid expansion, that would also help out in Rapid City, primarily for assistance in all the way from drug addiction to drug and alcohol addiction to just every other day normal, well, I can't say normal, but other health issues pertaining to mental health, and especially it's showing up during the pandemic now as well. That's my three comments. So
yeah, Councilman Nordstrom, a couple different things, one of which is, I think what you're hearing there, like there's this great misnomer that in a global public health pandemic crisis, the hospitals and healthcare is just getting fat and happy through it. My experience in Montana was, well, what that effectively meant is where they made money, elective surgeries and other things really dried up for quite a while. So the hospital system, and especially rural areas, were strained already. COVID actually put a further financial strain on them, and absent federal dollars coming in, we'd be losing a lot more hospitals. But I think in each of those areas, you're absolutely correct that Medicaid expansion can make a meaningful difference. If I was going to go to any of you and say, I'd love you to join this business that I started, I'll tell you that half of the customers aren't going to pay anything and the other half are expected to pay their share. It's not a very sustainable business model. And what we saw was the significant drop in uncompensated care made a difference urban and rural. And when I talk about 90,000 Montanans getting health care, also 30,000 people got mental health treatment. The co-occurring issues between physical health and mental health, or mental health and substance use disorder, that keeps people out of the workforce. And this is what preventative care can actually get them into the workforce if they have access to mental health. But in frontier states like where you all and I live in, look, we have enough challenges with recruiting doctors. Like we started a family practice residency program. We have enough challenges with trying to figure out the way to get mental health services in every corner of our state. It's that much more difficult if there's not financial ability to pay for that along the way. And that's what Medicaid expansion afforded. I mean, doubling the number, I think I noted that, doubling the number of substance use treatment providers that had Medicaid patients in our state, that was only possible because at the end of the day, they had the population that could pay. And that's the way that you get better access, and healthier South Dakotans is going to mean a healthier economy all the way around.
Hey, Adam, I think Mike Cole has a question, but was having difficulty raising his hand. So Mike, do you want to go? You have to unmute. There you go.
Very good. Can you hear me?
Yep.
All right. Governor Bullock, thanks so much for being on this call tonight. We really appreciate it. I also enjoyed, sort of the messaging arguments that you were making in terms of, it's almost more of an economic development or fiscal conservative reason to, adopt Medicaid statewide as opposed to a healthcare one. Not really at the end of the day, but you can see sort of the power of that messaging, I think, with certain people. My question is, I think sometimes it's one thing for, progressives to deliver that message, hoping to appeal to conservatives or Republican voters. But oftentimes, finding a Republican or a conservative or a hospital administrator, were you guys successful in recruiting some, messengers like that to deliver that message?
We were. Not as much initially. I mean, in 2015 and 13, I went to literally every single hospital in our state. And I would have sort of community forums. And then once you were on the ground and the hospitals did start to see what a benefit this would make, it did become easier in that respect. And in getting reauthorized, that I don't know how it works in South Dakota. In Montana, the State Chamber of Commerce isn't always the easiest customer to work with. But those local chambers of commerce made up of local business folks that want a thriving downtown, that want to make sure there's a tax base that are going to pay for their schools, that know that if their hospital's hurting, the whole town is hurting. Like we ended up by the end of like 2019, when we got it reauthorized again because of the experience. And even though Montanans had voted it down with that ballot initiative, now we had all of our hospital main folks out there talking, like the hospital administrators and chief medical officers. We had local chambers of commerce saying that this is an investment we as a state have to continue because of both the direct economic return and the healthier workforce. And I think in part of that really is what, at the end of the day, you need to get some people that you need to give them the license to know that, this isn't just some fuzzy thinking liberal program. This is a program that's darn important for your economy. And so on the one hand, I would tailor my message to who I'm talking to. If I'm talking to the most conservative group of businessmen and women out there, I'd say, well, boy, I'm saving you somewhere between $400 million and $1.1 billion a year because the state of Montana is covering your employees. And that's money then that you can reinvest in your company or put into profits. And I talk about the job creation. And as First Councilman said, look, you need a pipeline of talented trained workers now more than ever. But they also have to be able to, have the healthcare facilities to go to. It really can be not just this is the right thing to do for those working South Dakotans that are unable to get access to healthcare, but it's the right thing to do for those businesses, and it's the right thing to do for your overall economy.
Adam?
Yeah, hey, there we go. Hey, sorry about that. I was on mute. All right, look, let's we've got Sherry Smith here. Hey, Sherry, how you doing?
Good. Let's see. I bet
Sorry to keep you waiting there.
That's okay. I'm here for the story. I'm here for the show. I just had a couple of points to make. And so I know we're coalescing. So I'm really looking at how we can develop those talking points so that those people that aren't quite so policy wonkish can carry the message. And I think it's important to keep in mind that healthy children learn and healthy adults work. And if you're looking at building the strength of the state of South Dakota, that we should be keeping that in mind. Also, an entity that has not been touched on yet this evening is when I was a hospital administrator, I had multiple conversations with the sheriff and deputy sheriffs, and those individuals in law enforcement are very cognizant of the fact that they are holding up the end of mental health issues that are being dropped by the rest of healthcare. And if there's any way, and I think that that probably is a big order, because most typically those individuals do tend to lean towards the more conservative side, but they are the ones that on a daily basis deal with mental health crises, because people are not getting substance and substance abuse is not separate from mental health. It's a mental health issue. So that needs to be part of that package. So I don't know how you would do that, but I think those conversations would, besides speaking with people within the healthcare realm, that we should be reaching out to our law enforcement. I remember a million years ago when, I don't even know if her Hilton Paris or whatever, she was, locked up in a room, and the LA, sheriff said, we are putting mentally ill people in jail. And that was in the early 2000s. So we're still there. And those individuals within the realm of law enforcement, they may just be an untapped entity. I'm not so sure. But I think, and also my other point was, when you speak to cost shifting, it's because Medicaid does not cover all the expenses of having someone receiving health care, but it's better than nothing. But if you're cost shifting for wellness versus the expense of catastrophic care, it's huge. That's a huge difference. So, looking at those components, and I'm looking forward to how we develop that message so that those individuals out there having those coffees or the constituency meetings have a package that they can present that make complete sense. But I think I may just call up the Lawrence County Sheriff's Office and renew that conversation and see how we can feel out law enforcement to be, that would be a wonderful, peg under our footstool of support. But delusion's gotten me this far, so that's all I can say. Thank you.
Sherry, I might add on two instances too, when it comes to law enforcement, both on the mental health side, but like I remember before we had expansion, I mean, you should ask your Lawrence County Detention Center, how much money are you spending on untreated medical costs? Because there were, it's not an it's anecdotal, but there were people being discharged from prison because they were so sick and the county couldn't pay for those costs. And those would have been individuals that were Medicaid eligible. And we have seen, to the first point, an increase of low-income adults actually entering the workforce because of Medicaid expansion. Now, when we first passed it in Montana, we did a light touch that said everybody that's going to go on expansion, and this could be something after your ballot initiative passes, we're also going to have our Department of Labor reach out to say, what are your barriers to further employment? It wasn't in a punitive way, but what we ended up doing through that is we actually had the greatest increase in workforce participation of any state that had expanded Medicaid.
Hey, Steve, we got time for one more question. I see Kathy's got her hand raised. Kathy is notorious for collecting signatures for petition drives and has been involved in many of the campaigns I cited earlier in my comments. So Kathy, what's your question?
I missed the first part. I don't know if you already talked about this bill in the legislature, House Concurrent Resolution 5003. And it would say we have to have a 2/3 vote because it's going to cost more than $10 million. Have you talked about that?
Yeah, we haven't talked about that. We've been learning about how Montana was building back better, several years ago and trying to get some lessons and some advice from Governor Bullock.
People might want to speak up and try to stop that in the legislature, because that's a killer idea in there.
Yeah, Steve, and you probably have had this in Montana, but there have been numerous attempts since all this activity has taken place in the last 10 to 15 years to use the initiated measure process to shape public policy. Like things like minimum wage and corruption and payday lending. And the legislature continues to sort of chip away at our ability to do that. And there are numerous bills, more than just the one that Kathy mentioned, in the legislature this time again this year, and trying to unwind this process. And not many of them seem to get through at this point, but a few of them have, and they've been challenged in the courts. And we've had them thrown out. So we'll just continue to put pressure on the folks in Pierre not to do, something against the will of the voters. And if they do, we'll challenge them in the courts and have some success there. So, but thanks for raising that, Kathy. I want to give Steve the last word, but before I do, I really want to encourage you all to get on our website. It's Dakotans #4. DakotansForHealth.com. Download our petition packet. There are talking points, instructions, the requirement by the state that you have to have a circulator handout, and a petition. And you can print it out. You just need to make sure you print your petition on both sides, because they won't accept it, a 2-page petition. And we really, really need your help. Our grassroots are strong. And the stronger they become, 2 things are going to happen. One, I think it almost ensures we get this on the ballot, or something's on the ballot to deal with Medicaid expansion. And 2, it'll save money on the paid effort that we're in the process of putting together. So again, it's DakotansForHealth.com. It's #4. And if you haven't done it, do it now. Get us some signatures. That being said, Steve, you get the last word.
No, just thanks, Rick and Adam, but thank all of you for doing this. I look back on my 8 years as governor, and it's a conversation in a Target when someone walked up to me and told me what a difference healthcare ended up for her and her family. Or still remember a woman who was so excited about her purple prescription glasses. And she said, you know what, I got these through Medicaid. And I work full-time as a caregiver, but I could never afford to actually be able to see as well as I could. So the efforts make a difference. And I said at the beginning, I continue to be a little bit confounded on why there'd be political opposition to helping your economy, helping your citizens, helping keep your healthcare system. And no matter what sort of ideologues, actions people take in the legislature, when you get right down to it, South Dakotans and Montanans, we give a damn about our neighbors, and we know that it matters. So, and it unfortunately may be the only way that you'll get it through is by initiative. But that's the effort we're doing, because it makes such a big difference to your overall state. So keep up the good work.
Roland was a warrior from the land of the midnight sun, with a Thompson gun for hire, fighting to be done. The deal was made in Denmark on a dark and stormy day, so he set out for Biafra to join the bloody fray. Through 66 and 7, they fought the Congo War, with their fingers on their triggers, knee deep in gore. For days and nights they battled the Bantu to their knees. They killed to earn their living and to help out the Congolese. Roland the Thompson gunner, Roland comrades fought beside him, Van Owen and the rest. But of all the Thompson gunners, Roland was the best. So the CIA decided they wanted Roland dead. That son of a bitch Van Owen blew off Roland's head. Roland, the headless Thompson gunner, Norway's bravest sons up the score. They can still see his headless body stalking through the night in the muzzle flash of Roland's Thompson gun. In the muzzle flash of Roland's Thompson gun. Roland searched the continent for the man who done him in. He found him in Mombasa in a ballroom drinking gin. Roland aimed his Thompson gun, he didn't say a word, but he blew Van Owen's body from there to Johannesburg. Roland, the headless Thompson gunner, Roland, the headless Thompson gunner, Roland, the headless Thompson gunner, talking about the man, Roland, the headless Thompson gunner. The eternal Thompson gunner, still wandering through the night. Now it's 10 years later, but it still keeps up the fight. In Ireland, in Lebanon, in Palestine, in Berkeley,